Hi, my name is Lisa Schooley, and this is my Redemo for medication administration for week 10 skill. So the first thing I'm going to do is perform hand hygiene and enter the medication room. Okay, so I have my MAR and my healthcare provider's orders in front of me, so I'm just going to verify that they're for the correct patient and the correct orders. So I have patient Chester Chest with a date of birth of 7/19/19 for Dr. Levi, and he has ordered us to give ceftriaxone 1 gram IV push every 8 hours, and then ceftriaxone 1 gram IV push every 8 hours. The last dose was given 8 hours ago, so I know I can go ahead and give this. And then we are to flush the central line with heparin to heparin locket, and that heparin is an IV flush, 500 units, which converts to 5 mils with dimensional analysis. So then on my MAR, I have my heparin IV flush, 500 units, 5 mils. So I am good to go. So now I'm gonna get in my Pyxis and get my 2 medications. So I have my ceftriaxone 1 gram, ceftriaxone 1 gram, and then my heparin IV flush, 500 units, and I know converted that is 5 mils, and it is at 5 mils. And then before I leave, I'm going to do my second medication check. So I have my ceftriaxone 1 gram, ceftriaxone 1 gram, and then my heparin IV flush, 500 units, and that converts to 5 mils. So then I'm going to head into my patient's room. Normally, I would get flushes that are brand new in an actual setting, but for the video, they're opened. So I would knock, provide privacy, do hand hygiene, and get new gloves, but for the video, I'm just saving gloves. And then verify my patient. Hi Chester, my name is Lacey. I'm going to be your student nurse. I have some medications for you today. Can I just have you verify your name and date of birth for me? Chester Chest, 7/19/19. Perfect. So we have that ceftriaxone. It's an antibiotic for your infection that you got yesterday. You're just ready for your next dose. And then we are going to heparin lock your port. Do you have any questions? No? Okay. So the first thing I'm going to do is just do my medication checks. So I have ceftriaxone 1 gram, ceftriaxone 1 gram, and then my heparin IV flush, 500 units, and through dimensional analysis, I know that that's 5 mils. So due to this medication, I'm just going to get a second nurse to verify that is at 5 mils before I give it to my patient. Okay, Chester, I'm just gonna go ahead and clean that port before I give you your medications, okay? Okay. Clean for 30 seconds. Okay, so then I'm going to start with normal saline. Make sure there's no air bubbles. Okay, open the line, and then using the push-pause method. Sorry, I would aspirate first to make sure there's blood through the tube, but not into the syringe to make sure the line's still patent, and then do the push-pause method. Okay, and then keeping the plunger suppressed, walk the line, disconnect that, and then we're going to give the ceftriaxone. Make sure all the air bubbles are out. Open the line and push pause method again. Okay, and then keeping the plunger suppressed, walk it. And then we're going to flush the line with our flush, normal saline flush one more time. Get all the air bubbles out. Just to make sure all the medication is out of the line before we put that heparin in, okay? Push pause method again. Okay, make sure there's no air bubbles. We have our 5 mils. Make sure the plunger is pressed, lock it, and then we we are just going to clean up our workspace, make sure the patient's bed is in the lowest position, that he has his call light, clean up our area, make sure he doesn't need anything else. Then we'll document on the medication administration, how the patient tolerated it, and that we gave the medication, and then we will leave the room.